year 2. My name is Awab Musaad, and in this video I'm going to talk about some aspects of the pathology of hypertension. Alright, so let's begin. So before we dive into the hypertension, the disease itself, let's talk about the normal blood pressure. Usually it's the result of what? The cardiac output, the amount of blood pumped by the heart in each minute, multiplied by the peripheral resistance, basically applied by the vessels. So you can imagine the vessel like this. Okay, so we'd have two forces, the amount of blood and its contents pushing against the vessel, and the vessel itself pushing the blood, right? So this tension, we can call it the blood pressure. Okay, so if you have increase in the blood pressure, it will be probably because of increase in the cardiac or the blood content inside, or the resistance caused by the vessel. Okay, so we have normal values. Usually a normal blood pressure will be below 120 systolic and below 80 diastolic. Okay, so it will be elevated if the systolic got above 120 up to 129, but now we'll have stage 1 hypertension if it got 130 to 139 and the diastolic got 80 to 89 millimeters of mercury. Okay, but above that there will be stage 2 hypertension. Okay, so now we'll talk about the hypertension itself, and I'll classify them, or it's classified based on the causes. Okay, the most common one is the primary. Okay, and its cause is idiopathic. We don't know specifically what causes the primary hypertension, but after studying it, because it's very common, we studied it, we noticed some patterns, but now we know that there are some, let's say, risk factors. Okay, those might include the age, the family history, high intake of sodium, and race. All right, and for the secondary hypertension, you would guess now we have a reason, or we have a cause. Okay, the causes are a lot. Like, we have a lot of causes for secondary hypertension, you know, because of endocrine, some hormones. It can be also because of renal pathologies. It can be even psychological problems that might lead to hypertension. But generally, okay, I'll classify them there, or I think about them this way. Things that causes, or the renal pathologies, okay, that will cause increase in the blood content itself, and some things that will lead to increase in the peripheral resistance caused by the vessels, like vasoconstriction and the growth of the vessel. Okay, so let's get back to this idea again. So if you remember, anything that causes the increase in the blood, like renal pathologies, because we have less excretion, right, it will lead to increased blood pressure. Same thing here, because we increase the peripheral resistance because of vasoconstriction or growth of the vessel itself. Okay, it will press upon the blood more, so it will lead also to increased blood pressure. Okay, so that's based on the causes. We have primary, idiopathic, and secondary. It has many causes, and generally they cause one of those three things. Now, for the hypertension itself, it progresses in two different ways. Okay, it can be either benign or malignant. Okay, now for the benign hypertension, you would guess, as the name suggests, there is no acute symptoms. Okay, or maybe no symptoms at all. Okay, but actually in the vessel itself, because of the increased tension, the wall is getting thinner. Okay, and there are some spaces starting to appear between the cells themselves, and proteins can leak into those spaces of the vessel. Okay, and causing this thing. You can see in the PAS stain, or the periodic acid shift stain. You can see how this is the lumen of the arteriole. This is the renal arteriole. You can see how the lumen is narrowed. Okay, because of the thickness, increased thickness in the arteriole caused by the proteins leaking into the vessel itself. Okay, so if you notice this shape, it looks like the hyaline cartilage. So this is a microscopic picture of the hyaline cartilage. See how it looks like it? Okay, so you can describe this picture, okay, as hyaline arteriosclerosis. You have an arteriole that got narrower, and it looks like hyaline, the proteins that cause the narrowing. So hyaline arteriosclerosis. That's a microscopic picture that we see in benign hypertension. Okay. In contrast, in the accelerated hypertension, we have two possible findings, or microscopic findings, in the vessels. Okay, one, you would see the smooth muscles proliferating, okay, to compensate for the increased or accelerated hypertension. Okay, so in this renal arteriole, you see how the smooth muscles are proliferating. You can barely see the lumen. Okay, so we call this the hyperplastic arteriosclerosis because it's caused by accelerated or malignant hypertension. Okay, but if there is damage because of the accelerated hypertension, there is damage to the vessel. Okay, the cells within the vessel themselves, they will have, or they will undergo necrosis. Okay, or specifically fibrinoid necrosis. All right, so because of damage, we have necrosis, and usually necrosis, in contrast to apoptosis, it will have inflammation. So in this renal artery, there is damage. Okay, you can see the lumen, there is inflammation. So we call this the necrotizing arteriolitis. Okay, we have inflammation caused by necrosis. So we can see those two microscopic pictures in accelerated hypertension. All right. Now, because of the hypertension, we'd have complications. Okay, and this complication can be seen in different organs because of the increased tension within the vessels. Okay, for example, the kidneys have really fragile vessels that are needed for the clearance. Okay, you will take it next semester how the renal arteries bifurcate and go within the kidney itself. Usually they're small, they're fragile, needed for the clearance with the glomeruli. But in case of hypertension, they will get distended like this. Okay, and they will be susceptible for rupture. In case of benign nephrosclerosis, okay, you would have, in a benign hypertension, it has the benign nephrosclerosis. You'd see how the kidney is shrunken, and you have those pumps caused by the increased tension within the small vessels inside the kidney. So you'd have this shape. If you took a sample of this kidney and view it under the microscope, okay, you'd see something like this. So let's focus on the arteries. In this case, okay, you can see how the artery, you can barely see the lumen within those arteries. Okay, there's sclerosis, severe sclerosis caused by the hypertension in those vessels. Okay, also because there's that's an outcome of benign hypertension, but malignant hypertension can cause the malignant nephrosclerosis, and that has shape of a Flea-Beaton appearance. It's a Flea-Beaton appearance. It's quite iconic of the malignant nephrosclerosis. Okay, in the brain also, because we have small fragile vessels. Okay, if they rupture, it will cause intracranial hemorrhage. Okay, so this transection of the brain, the hemorrhage can happen anywhere in the brain. It will cause something called the mass effect. A mass effect that will affect a portion of the brain, and the symptoms will be, regarded or based on where the mass is affecting, or which part of the brain, and the symptoms will be manifesting accordingly. Another organ is the heart, but in this case, we're not talking about ruptured vessels. We're talking about the compensation caused by the hypertension in the heart. So because we have increased pressure in the aorta, or that the heart has to press against, so we will have hypertrophy of the muscles of the myocardium of the heart, of the left ventricle specifically, but that will cause the lumen to narrow itself. So by time, with time, you would have even less blood pumped by the left ventricle because of the narrowed lumen. That might lead to heart failure. Okay, and last organ we're going to talk about is the eyes. So eyes also have fragile small vessels. Okay, so hypertension will cause the retinopathy. You have those pictures in your slides as well. So we can evaluate the vision by looking at this disc. So normally the margins of the disc here, okay, they will be clear. Okay, you can see it easily. But in case of hypertension of papilledema, you can barely see the margins. They are quite scattered. You can't see them, or you can't identify the margins clearly. Okay, so that's also something specific within the class, and there's stages for that. Okay, and thank you for watching. I hope you leave a feedback, and good luck in your studies, and thank you. Salam.